Hello everyone, so today we're going to be talking about another condition known as irritable bowel syndrome or irritable bowel disease. So basically, this covers gastrointestinal issues, and this disorder or this syndrome is a chronic functional gastrointestinal disorder, and is usually characterized by abdominal pain, bloating, and altered bowel habits without any identifiable structural or biochemical abnormalities. So it is a common disorder that affects the large intestine, and it is often associated with stress, diet, and gut-brain interaction. So unlike inflammatory bowel disease, which is another condition which is known as IBD, while irritable bowel syndrome is known as IBS. So unlike inflammatory bowel disease such as Crohn's disease and ulcerative colitis, irritable bowel syndrome does not cause permanent damage to the intestines. So that is basically the difference between these two conditions. So irritable bowel syndrome has been recognized for decades as a prevalent gastrointestinal condition, and it significantly impacts the quality of life. And it is estimated that about 15% of the global population experience this irritable bowel syndrome, if not once in a week or once in a month, and only like a fraction usually seeks medical attention. So the disorder was previously referred to as spastic colon or mucus colitis or nervous colon, and it was called this because it was emphasizing this association with bowel motility and psychological factors. So when we're looking at the signs and symptoms of this irritable bowel syndrome, so it usually presents with a range of symptoms including abdominal pain and cramping, which is typically relieved after defecation, after going to the toilet, and often linked to bowel movements. So we have abdominal pain and cramping. Then we have altered bowel habits, like sometimes you could have constipation, which is when irritable bowel syndrome comes with constipation. We tag this as IBS-C. Then sometimes you can have diarrhea. When this syndrome comes with diarrhea, we tag it IBS-D. So you could have either the symptoms of diarrhea, constipation, or even the mix of the two in worst cases. So there could also be bloating and gas, like you have increased gas production and altered gut motility, which contributes to bloating. Then there could also be mucus in the stool. So unlike other gastrointestinal disorders, this irritable bowel syndrome can cause excessive mucus secretion in stools. So that is one peculiar thing about this condition. And then there could also be urgency and incomplete evacuation, like a frequent need to use the restroom, or a feeling of you use the restroom but what you went to go and do, like what you wanted to defecate, it didn't come out, or you finish using the restroom and it just feels like as you finish it you want to go again, like you not even go the first time. So incomplete defecation, or feeling like not feeling at ease after using the restroom. So that is basically what this, and that is basically one of the symptoms too. Then fatigue and sleep disturbances. So this irritable bowel syndrome, it can impact the overall being and lead to chronic fatigue. So when we look at the clinical presentation, Irritable bowel syndrome can manifest differently in patients based on their predominant symptom type. So, like I said before, sometimes there can be this syndrome with diarrhea, accompanied with diarrhea. So this kind of patients will see frequent loose stools, urgency to always use the restroom, and abdominal discomfort. Then when we have the condition where it's accompanied with constipation, it presents as hard, infrequent stools and difficulty passing stool. Then when it's the case of the mixed irritable bowel syndrome, you will see alternating between diarrhea and constipation. So 1 minute you are stooling everything, another minute nothing wants to come out. So it's a mix of the two. And then we also have unclassified irritable bowel syndrome. So this one, in these cases, symptoms like the normal symptoms that we know for this syndrome, they do not usually fit into this particular kind. So the symptoms do not fit in with the other 3 categories that I've mentioned before. So symptoms may be intermittent, and they can be triggered by stress, certain foods, like spicy foods, or hormonal changes, and even infections. So talking about the etiology now, that is the cause of this irritable bowel syndrome. So the exact cause of this syndrome is unknown, but several factors can contribute to the development. Like, for example, number 1, having altered gut motility. So abnormal contractions in the intestine can often lead to either diarrhea or constipation. So this is what can lead to having the mixed case of this syndrome. Then we can also look at visceral hypersensitivity, which means like increased sensitivity of the gut nerves, leading to pain and discomfort. So this could be what could attribute to the abdominal pain that is felt in this condition. Then we also have gut-brain axis dysfunction. So here it basically talks about like the disruptions in the communication between the gut and the central nervous system, which play a crucial role. Then another contributing factor could be the altered gut microbiota. So imbalances in our normal gut flora may contribute to this irritable bowel syndrome symptoms. So maybe, for example, we've been using antibiotics to treat a condition for a while, so it could affect this our normal gut flora and cause these symptoms. Then there's also something known as post-infectious irritable bowel syndrome. So some cases of this condition can develop after having a gastrointestinal infection. Like, for example, after having typhoid fever, you could have these symptoms. Then psychosocial factors too, like stress, anxiety, and depression, can exacerbate symptoms too. Then dietary triggers, like I said before, certain foods, especially spicy foods, dairy, caffeine, high fat meals, they may worsen the symptoms of irritable bowel syndrome. So talking about the risk factors, certain factors increase the likelihood of developing this condition. Like, for example, let's look at gender now. Women are more commonly affected than men, and when we're looking at age, is more common in individuals under 50 years old. Then family history, genetic predisposition also plays a role in this IBS development. The mental health conditions like anxiety, depression, and past trauma, they are also linked to this IBS. Then gastrointestinal infections, like I said before, having a history of bacterial, viral, or even parasitic infections increases the risk of having this IBS. Then dietary habits too, like taking low fiber diets and excessive consumption of trigger foods may worsen symptoms, like just taking foods that would trigger you could also worsen these symptoms. Then we also look at the anatomy and the physiology of this condition. So when we are talking about this anatomy and physiology, so the digestive system, particularly the large intestine, is the culprit here for this condition. So the large intestine, that is the colon, is responsible for absorbing water and electrolytes. So it's responsible for absorbing water, absorbing electrolytes, forming stool, and facilitating defecation. So the enteric nervous system regulates gut motility, while the gut microbiome maintains digestive balance. So in IBS, that is Irritable Bowel Syndrome, there is dysregulation in these systems, which leads to abnormal bowel habits and discomfort. So that is basically about the physiology of it. Then when we're looking at the pathophysiology, so is pathophysiology, we look at abnormal gut motility, like increased or decreased peristalsis will lead to diarrhea or constipation. Then, like I said before, I mentioned this abnormal gut motility, visceral hypersensitivity, that is heightened pain perception in response to normal gut activity. Then immune system activation, so low grade inflammation may contribute to the symptoms of this condition. Neurotransmitter imbalance, so altered serotonin levels impact gut motility and sensation, leading to imbalance. And then gut microbiome changes, like disruptions in microbial diversity, can affect this digestion and immunity. So when we are looking at the diagnosis, IBS is usually diagnosed based on clinical criteria, including there's something called Rome IV criteria. So this criteria requires recurrent abdominal pain at least 1 day per week in the last 3 months, associated with 2 or more of the following. Like you could also have defecation, change in stool frequency, change in stool form, like the shape of the stool. Then when doing following this clinical criteria too, we could also exclude other conditions like performing of blood tests, stool tests, and imaging to rule out inflammatory bowel disease, which could also be the cause of the condition, and to rule out other infections too, like celiac disease. Then endoscopy and colonoscopy could be done too, but it's not usually routinely required, but it may be performed if there are red flags, like for example, the person is having weight loss or the person is having rectal bleeding. That is when we usually perform this procedure. Then when we're looking at the differential diagnosis, so conditions that may mimic this irritable bowel syndrome, like I explained earlier, inflammatory bowel disease could mimic these symptoms of IBS, like Crohn's disease and ulcerative colitis. Then celiac disease to lactose intolerance or fructose intolerance, colon cancer, and also small intestine bacterial overgrowth. So all these conditions, they can mimic the same symptoms as irritable bowel syndrome. So you'll be having abdominal pain, you will having either diarrhea or constipation, so they can just mimic the same symptoms. Then for the management of this condition, so first like I always say, we look at the non-pharmacological treatments, like the lifestyle modifications that you could do to support yourself before or together with the medications you are taking. So for example, like having there's something called FODMAP diet. So it's basically a diet where you avoid fermentable oligosaccharides, disaccharides, monosaccharides, and we see all these things mostly in starch foods. So having a low starch diet, we see it in carbohydrates. Starch is also a carbohydrate, so we see it in carbohydrates. All these molecules, we see it in carbohydrates. Then increasing fiber intake for in cases when you have irritable bowel syndrome accompanied with constipation. Increasing fiber intake could help, and avoiding insoluble fibers for when this irritable bowel syndrome is accompanied with diarrhea. So hydration too. Hydration is very important. I think I talked about this in my previous videos. Hydration is very important for most of the conditions that occurs in humans. Hydration is very good, like drinking in adequate fluids, which always contributes to improve digestion. Then stress management, so like meditation, cognitive behavioral therapies, yoga, it may help in that aspect. Then regular exercise too improves bowel function and reduces stress. So regular exercise is very good, especially in the morning. Just try to do as little as you can. Even if you can't do in the morning, you can do in the evening. So just try to put regular exercise in your daily activities. Then for the pharmacological treatments, when this irritable bowel syndrome is accompanied with diarrhea, so we could give anti-diarrheal agents like loperamide. Then for severe cases, we could give this serotonin receptor antagonist, allocetrone, in severe cases. And we could also give antibiotics like rifaximin for suspected bacterial overgrowth. Then when this IBS is accompanied by constipation, we could give osmotic laxatives like lactulose, polyethylene glycol, and we could also give secretagogues like linaclotide they usually enhance with intestinal fluid secretion, so we could give secretagogues to help too. Then in cases where the patient is having pain and bloating, we could give antispasmodics like hyoscine, dicyclomine. So we could give these antispasmodics to help for the pain. Then low dose tricyclic antidepressants can also help for the pain, like amitriptyline for the pain modulation. Then we could give selective serotonin reuptake inhibitors for comorbid anxiety and depression that might be contributing to this condition. Then probiotics too, they are very good because they help to improve the gut microbiota imbalance, which could be causing this condition, and also give symptom relief. So for the prognosis of this irritable bowel syndrome, like I explained before, it's a chronic condition with fluctuating symptoms, but it does not cause structural damage to the intestines, unlike inflammatory bowel disease, which causes irreversible damage. So with proper treatment, most patients can lead a normal life, and however, the quality of life may be impacted by persisting symptoms like frequent use of the restroom and all that, and it might require long-term symptom control. But taking the right medications, having lifestyle adjustments is basically what the patient needs for this condition. So that is it about irritable bowel syndrome.